Traumatic injuries are the leading cause of death among Americans under the age of 45. San Diego's medical community partnered with the county 3 decades ago to improve the odds of surviving a traumatic injury, and it worked. The San Diego County trauma system has cut the number of trauma deaths in half over those 30 years. Here to talk about where we stand now and what's next are my guests, Dr. Michael Seiss, Medical Director of Trauma at Scripps Mercy Hospital, and Dr. Bruce Hayes, Medical Director of San Diego Emergency Medical Services. Welcome to you both.
Thank you.
Thank you.
So, Dr. Hayes, before the trauma system was put into place, people would just get taken to the nearest hospital. What was wrong with that old system?
They would, and I think what was wrong was nothing necessarily with the hospital, but the fact that it wasn't organized and ready to go to take care of a dying patient.
Okay, so just explain a little bit about how the system has completely changed that.
Now there are 6 trauma centers. Each has a distinct area from which patients come in, and they have in the hospital or on call all the physicians and specialties needed, and then in addition highly qualified nurses, hospital personnel who can immediately work to save the patient's life. And in addition, we have, of course, the field people, the paramedics and EMTs in the field, who keep the patients alive while they're on their way to the surgeon in the hospital.
Pretty good system. So, Dr. Seiss, what kind of trauma do you see the most now, and has that changed in the last 30 years?
It's changed significantly over the course of the 30 years. For instance, back in the mid-90s, we had as high as a 35% penetrating trauma rate, gunshot wounds and stabbings. That's dropped countywide to less than 10% with the effect of good community policing and all the community efforts that law enforcement in conjunction with other agencies have brought forward. Now we're continuing to see motor vehicle crashes, but they're much more survivable because cars are so much more safe. Unfortunately, with our aging population, we're living longer with heart disease and cancer because of medical advances, folks are falling. 25% of everyone in San Diego County over age 65 this year will fall. And once we get to 90, it's almost 100%.
Isn't that interesting? So the trauma system is very important for the older population.
It really is. More and more of our folks are old and sick and injured.
Okay, so Dr. Haynes, there are 6 hospitals in the system. What determines where a patient will get taken?
The patient goes where they get their injury. So that each of those areas has a catchment area, as we said, and they get the patients from that particular geographic location.
So we have a map right now to show the different locations. So, does it depend on which area you are, where you get taken?
It does, exactly.
Mm-hmm. Okay, so that...
Unless you're a child, and a child who has a major injury goes to Children's Hospital as long as they're 14 years or under.
So that, in fact, reduces the amount of time it takes to get you wherever you need to go.
It should.
Yeah. So, Dr. Seiss, apparently other counties have tried to emulate our trauma system, and it hasn't been as effective as ours. Why is that?
Well, I think we had, early on, good partnerships between competing health systems and our partners at the county to do the best thing for the patient. We also had, right from the start, a very honest review of all of the care, looking for opportunities for improvement. And we still meet every month to review all the care provided to all patients, all the things that went well, all the things that didn't, and how we can do better.
And has new technology made a big difference also to the survival rate?
Well, new technology definitely has, but things hidden in plain sight. For instance, learning that we don't give salt water to people who are injured, saline, we give blood transfusions. Using feeding tubes and feeding people by the intestinal tract sooner than by vein, using different modes of supporting your breathing. All those things we've learned over the last 3 decades have strikingly improved the outcome after injury.
Okay, are there any gaps in the service? What do you see looking ahead? We've seen 30 years of a successful development of this system. Dr. Haynes, what would you say you're looking to see in the future, would you like to see?
I think that if we can find the technology that we need for the sickest patients, the ones who have organ failure and who are not doing well, that will be a big improvement.
Okay, and Dr. Seiss, what would you like to see?
Prevention. There's no question about it. We want to put ourselves out of business. We really do. And preventing injury is an important part of this. Cutting down on high-risk behaviors, drinking and driving, drinking and doing almost anything, drug use, making our seniors more fit and healthy so they're less likely to fall. We're out there with the community looking at things like youth access to alcohol, cutting that down, elder health, and the Fall Prevention Task Force. So we really want to be out there and preventing these injuries in the first place.
It's all about getting people to behave in healthier ways. Good. Thank you so much. That's Dr. Bruce Seiss of the Trauma Center at Scripps Mercy and Dr. Bruce Haynes, who is Medical Director of San Diego's Emergency Medical Services. Thank you so much for joining us.